Okay, what is the purpose of a cardiac screening? Cardiac screening is designed to pick up heart disease early before it causes problems. Now, heart disease and stroke are the biggest causes of death in the world. About 1/3 of us will die from a heart attack or a stroke. And the disease process often starts a long time before the heart attack happens. So if you have a heart attack in your 50s or 60s, actually the disease that leads to the heart attack starts in your 20s or 30s. So the purpose of the cardiac screen is actually to look at you in more detail, try and pick up any risk factors that you've got for a heart attack and stroke, and if you pick them up early, you can treat them early and prevent heart attacks and strokes. And the classic things that we're trying to pick up are high blood pressure, high cholesterol, diabetes, and also looking at the arteries and trying to see if you've got any signs of any arterial disease or atherosclerosis at that time. Heart disease is the standard term for diseases that generally affect the coronary arteries. So what happens to actually most of us over time is that the artery walls get infiltrated with cholesterol particles and inflammatory cells. And what these develop into kind of fatty plaques, fatty cholesterol plaques in the walls of the arteries. And this is a gradual process over the course of many years. And then when you have a plaque in place in the artery, that plaque can go on to cause a blockage in the artery. And that in itself can cause things like chest pain or angina. And angina is when you start to get chest pain when you're exerting yourself. So angina is part of heart disease. And then also, if you've got plaques in the arteries in the heart, they can get inflamed at times. And when they get inflamed, they can rupture, essentially like a pimple. And when they rupture their contents into the artery, a clot forms very quickly. And that is a heart attack. It's when the clot forms in the artery and acutely occludes the artery. And that's similarly, a clot can form also in the neck arteries, and that's when a stroke happens. So all of us should go for a cardiac screening. Now, one of the ways to determine if you should go for a cardiac screening is to define who are the higher risk groups. So men, probably from the age of 30 onwards, should start to get some cardiac screening done. And it might start off with some basic tests, just like a blood pressure, a cholesterol test, maybe an ECG and an ultrasound. And that'll be enough to kind of start to pick up any signs of any heart disease. Other people that should go for a cardiac screen are people that have got a family history of heart disease. So if your mum or your dad had a heart attack at some point, then that puts you at risk of heart disease as well. So if you've got that family history, you should consider getting screening earlier. And again, women also get heart disease. It's a common misconception that women don't have heart attacks as often as men, but it's not true. Women have the same rate of heart disease as men do. It's just that they tend to develop the disease about 10 years after men. So women in their 30s to 40s should also get cardiac screening. And actually now the guidelines suggest that even children that have a family history of heart disease should have their cholesterol checked. And that's a very simple test just to ensure there's no genetic high cholesterol in the family. Okay, so what happens during a cardiac screen? So the purpose of the cardiac screen is to pick up disease and pick up risk factors. So it starts off with some blood tests, and these blood tests will look for cholesterol, they'll look for presence of diabetes, they'll look at your kidney function. Then after the blood tests, you'll probably go on to have an ECG tracing done to look to see if there's any changes in the heart on the ECG. That's probably the most basic part of cardiac screening. But then you'll also consider going on to something a bit more advanced, which would be an ultrasound of the heart or the arteries, and also something called a CT calcium score, which looks for any signs of any calcium or plaque in the heart arteries. And then even more advanced is to have a CT coronary angiogram, which actually allows us to directly visualize the heart arteries and see if there's any coronary artery disease there. In addition, you can look for disease in other arterial beds, and you can do that by doing a quick ultrasound of the neck arteries, and that allows us to determine if you've got any plaque in the neck arteries. So the screening process, there can be multiple different types of screening, from the very basic, just looking for very simple risk factors like blood pressure, to all the way through to more advanced testing like CT scans. Okay, how often does a cardiac screening need to be taken? So on a basic level, once you've started getting a cardiac screen, you should probably get at least your blood tests and your blood pressure checked on an annual basis. However, if you're getting more advanced tests like CT calcium scores, you probably don't need to get them done more frequently than every 2 years. And because any CT scan has also got some radiation, so you cannot do them too frequently. But as a basic rule, everyone should have their blood pressure checked on a yearly basis at least, along with cholesterol. So in summary, cardiac screening is necessary to pick up heart disease early before it causes a heart attack and even stroke. And the cardiac screening is very simple, and at the most basic form, all you need to do is get some blood tests, some blood pressure check, and even an ECG. And there's a lot more advanced types of screening available to look for more advanced forms of disease. But everyone should get some cardiac screening done and have it as an ongoing basis.